Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Diana Lenrojana. Now I and my friends will explain or show our presentation according from our discussion, specifically focusing on Kwashiorkor and Marasmus. Okay, before that, I will introduce my team. From the team there is Natasha Jahwa, Bella Lutfia, Abidul Adel, Husrus, and me is Diana Lelanujana. Before game, my friends will explain more specific points. I will explain in general what is Kwashiorkor and what is Marasmus. Malnutrition is food intake that less than what is needed in resulting biological of the person. In general, malnutrition divided into two parts. First is undernutrition and two is overnutrition. Malnutrition consists of marasmus, kwashiorkor, and for the overnutrition, called obesity. Okay, we'll explain about kwashiorkor. The definition of kwashiorkor is a form severe malnutrition caused by long-term deficiency, and the reason why people get this disease, or commonly children, is caused by long-term lack of protein, vitamin, and mineral intake. Children who only eat carbohydrate sources such as rice and corn in the long term are also can get risk of experiencing this disease or kwashiorkor. And next, for marasmus, the definition of marasmus is a sore form of malnutrition caused by a lack of energy. This is common condition in developing country, especially among children. Like before, both are equally common in children. And the reason of marasmus is because nutritional deficiency and socioeconomic condition or infection disease characterized by people with marasmus appear very thin and looks like they have lost a lot of fat and muscle. As you can see in previous slide or in first slide, there is example of body children. They get kwashiorkor and marasmus. The body is different from normally. So the next presentation will explain by Natasha Jahwa.
Okay, for the first topic is difference between Kwashiorkor and Marasmus. From this picture, we can see the difference between Kwashiorkor and Marasmus. So the effects seem to be inversely proportional. And also we can see on the table in this slide, there are several aspects for the identify the difference between Kwashiorkor and Marasmus. From the reason, symptom, metabolism, and organ function. For example, one is the reason. If Kwashiorkor, the reason is long-term protein deficiency, and the Marasmus is general chloride deficiency.
Okay, so as previously explained, Kwashiorkor and Marasmus are two main forms of severe malnutrition that are often found in children in developing countries. Both are caused by nutritional deficiencies but have different characteristics and metabolic causes. For Kwashiorkor, it occurs due to protein deficiency even though calorie intake may still be sufficient. This often occurs in children who are weaned too early and given foods that are rich in carbohydrates but low in protein. And metabolism, which is behind the condition of Kwashiorkor, there are 3 points, namely albumin deficiency. Lack of protein intake causes a decrease in albumin production in the liver. Albumin is the main protein in the blood that helps maintain osmotic pressure and prevents edema. A lack of albumin causes fluid to move from the blood vessels to the tissues, causing the edema or swelling characteristic of Kwashiorkor. And protein synthesis disorder. Without enough protein, the body cannot synthesize essential proteins needed for tissue growth and repair. It causes muscle atrophy, brittle hair, and damage to the immune system. And liver dysfunction. The liver cannot process lipids properly, which causes fat infiltration in the liver and causes liver enlargement or hepatomegaly.
So for the metabolism of Marasmus, we have like a depletion of energy reserves. Due to lack of calorie intake, the body begins to break down fat and muscle protein reserves to meet energy needs, which this causes significant weight loss and visible wasting. And for the next point, decreased muscle mass. The body uses muscle protein for energy and also resulting in severe decrease in muscle mass. Children with Marasmus appear very thin and have little body fat. And for the next point, organ function disorders. Without enough energy and nutrition, the function of vital organs is disrupted. The immune system weakens, making children more susceptible to infections. And for the next point, growth disorders. Chronic nutritional deficiency cause significant disorders of physical growth and mental development. So treating these conditions requires a different approach. Kwashiorkor requires protein supplementation and edema management, while Marasmus requires increasing overall calorie intake with a gradual approach to avoid refeeding syndrome. So for the point C, starvation ketoacidosis mechanism in pathway. It explains like what will be happen when starvation begins in our body, like what changes what will happen in our bodies. Starvation begins when the body runs out stored glycogen in our bodies, and also insulin decreases while glycogen increases, and also fat breakdowns into adipose tissues, and also fatty acids released to liver, and then liver converts fatty acids into ketone bodies.
For 3 points, the starvation ketogenesis might happen during starvation. It is have several points. So for the first point, its ketones circulate in the bloodstream from use as energy. This means that ketones are produced in the liver from the fatty acid when glucose levels are low, such as during fasted or low carbohydrates intake. These ketones are then circulated in the bloodstream to be used as alternative fuel source by tissue and organ, including the brain. Number 2, its ketone production exceeds utilization. It means in this case, in certain situations such as uncontrolled diabetes or prolonged fasting, the production of ketones may exceed their utilization by cell of energy. This can lead to the accumulation of ketones in the bloodstream, causing a condition known as ketoacidosis. Number 3, high level of ketone cause the blood to become more acidic, leading to the ketoacidosis. It means in this case, when ketone level in the blood become too high, they can lead to a condition called ketoacidosis. The excess ketone cause the blood of become more acidic, which can result in symptoms such as urea, vomiting, nausea, difficulty breathing, and some cases can lead to coma or ketoacidosis is the medical emergency and require immediate treatment. Thank you.
Also, we have reference according from our material. There is 3 reference, and this is our last slide in this presentation. Thank you for watching and thank you for the attention until duration end. See you. Wassalamualaikum warahmatullahi wabarakatuh.